I want to tell you about the broad categorization depending upon the clinical manifestation. So, depending upon the clinical presentation, out of these 1,902 described inherited metabolic disorders, 80% of these disorders present with the brain involvement. So they come under the category of neurometabolic disorder. Around 10 to 15%, I will say 15, more than 15% patient present with the metabolic liver disease. So they have a liver disease which was not identified by extensive other testing, other testing like Wilson disease. They present with acute hepatitis, but not able to identify with the routine testing. And very few clinicians have a very high index suspicion for Wilson disease. But nowadays, the awareness is raising, and many clinicians are able to identify the metabolic liver disease because of Wilson disease. Because the carrier rate of Wilson disease is 1 in 90. It's too high. It's very high. It's very high. So mm, you can estimate that how many people across the country are carrier of Wilson disease. And whenever they get married with a person who has having same gene defect, there is 25% risk of having disease in their progeny. So I want to cut it short. So whenever a patient is suffering from any unexplained neurological illness, so they should be evaluated for possibility of inherited metabolic disorder. And whenever a baby is suffering from liver disease, and we are not able to identify the cause of liver disease, even after doing the infectious panel, viral illnesses, some bacterial illnesses, UTI, and other causes, or biliary atresia, then we should think for a possibility of underlying inherited metabolic disorder. So these are two broad categories. So neurological symptoms can be of different type. That can be a hypokinetic movement, that can be hyperkinetic movement, that can be tone disturbances, they can have developmental delay, they can have intellectual disability, they can have epilepsy, they can have autistic features, they can have hyperactivity. Like Sanfilippo disease patient present with hyperactivity. So they don't have any other manifestation apart the major clinical manifestation in hyperactivity. Few diseases which are not under having brain involvement or liver involvement, they can present with the bony involvement, like Morquio disease. So Morquio disease patient can have a bony involvement. They can have a spinal problems, and few disorders they can involve mainly heart, like Pompe disease. So Pompe disease patient can have only cardiac involvement. So, so the first point is, if any clinician is getting a patient who has having unexplained neurological involvement, he should think for a possibility of underlying metabolic disorders. Similarly, if patient is having liver disease and not able to identify the cause, he should think for a possibility of metabolic disorders. These are commonly missed